Dr. Scire is a doctor who really has started to put it all together. For nearly 2 decades, he's worked in functional neurology and neuroimmunology, helping families who've tried everything, yet oftentimes have made very little progress. That's because they're missing a big connection, the nervous system. If your body is wired to be, very simply in fight and flight all the time, then that's going to activate your immune system all the time, right?
For most people today in the world that we are in, people are more sympathetic dominant. So they're going to create a tremendous amount of central nervous system inflammation, which is going to really come from a lot of body inflammation. Okay. So now they're going to have this increased CNS inflammation that's going to happen in their brain. They're going to have these inflammatory cascades that happen in their brain that's going to reduce functional connectivity.
Can you help us kind of unpack those different, I guess I would say buckets of different philosophies and kind of give some context to them?
The brain is the master system and is controlling all downstream mechanisms.
How do you see this progressing in the next 5 years? How do you see the treatment of autism and neurodevelopment in general going?
The NeuroTrition Podcast is sponsored by North Florida Spine and Wellness and produced by Juming Delmas Studios.
This year has shown an explosion of interest in alternative and functional treatments for not only autism, but neurodevelopmental disorders in general. But it's also created a ton of confusion on what works and what doesn't. There aren't many people that I trust to cut through all of this noise, but today's guest is one of those people. Dr. Peter Scire isn't your typical functional medicine doctor. While there are many groups of doctors and providers out there doing everything from biomedical to functional medicine to gut healing, and really they all seem to claim to have these really singular solutions to complex problems. Dr. Scire is a doctor who really has started to put it all together, that it's not just all about the gut, it's not just all about these chemical processes, but it's also about the neurology. For nearly 2 decades, he's worked in functional neurology and neuroimmunology, helping families who've tried everything, yet oftentimes have made very little progress. That's because they're missing a big connection, the nervous system. While Dr. Scire focuses on inflammation and immune dysregulation that affects development, he also is very keen on rebuilding the nervous system from the ground up, integrating primitive reflexes, sensory motor regulation, and hemispheric balancing that organize the entire brain and the body in a process we both use called Melillo method. Today, he is here to cut through the noise, challenge the dogma, and reveal what is fact and what is fiction and why the nervous system matters, not just promote another trend. Dr. Scire, welcome to the NeuroTrition Podcast.
It's great to be here. Thank you for inviting me.
So I always find it interesting, in our field, I feel like we're kind of in a unique position on how we're trained. We're not trained to look at different body parts in a vacuum. We're really trained to look at the whole body and how it all kind of integrates and works together, which when you're talking about autism or, neurodevelopment in general, I think that's a really important thing. For me, when I got into practice, I dabbled in some functional medicine to begin with, and it really wasn't until my son was diagnosed with autism that I really got into this world of functional neurology. So I'm really curious, your journey on how you came to kind of make this realization to practice how you do.
Well, I was fortunate. I discovered functional neurology, or what it was called chiropractic neurology, when I was a student at Life University. So I think I was like probably my first year at chiropractic college when I decided to attend my first post-grad seminar. And I'll remember it. It was as if it was yesterday. It was entitled Posture and Systemic Health. And it was Dr. Dan Murphy. Um, and when I heard him speak, he was really talking about this integration of neurology and relationship to health and systemic health specifically. Again, this was like 1999. So, I think we were just beginning to really understand the relationship between the nervous system and the immune system. And then he started talking about this whole concept of chiropractic neurology. So I got into it early on in my career. So I was probably, again, like first year chiropractic college. And then I started looking into the neurology training. and started taking all those courses while I was a student in chiropractic. And, um, and then, my dad got sick while I was in school, and unfortunately, my dad got diagnosed with terminal cancer, and I had to take some time away from school at the time. And my son was born during that time as well. So when I was going through all that in terms of being a young father and grieving the loss of my own father, I chose to really actually spend a lot of time, working and learning neurology. And so I went at it really hard. So by the time I actually graduated from chiropractic college, I'd done all the hours required to achieve the board qualifications for neurology. And during that time is actually when I met Dr. Melillo. So I think it was kind of this perfect timing in my life that I don't know if I would have met him had I, had my dad not gotten sick or my son wasn't born at that time. It was one of those things where you look back on life and go like, wow, like that just happened at the right moment, right? You know, I lose my dad, but then all of a sudden I have this amazing man come into my life in Dr. Malillo. And forever changed the course of my career. I mean, I
Yeah.
was able to come right out of school and I didn't pass go. I mean, that was the first thing I did. I was talking to a friend of mine the other day about, remembering my first patient. My first patient that was sent to me, referred to me by a colleague of mine, was a dystonia patient, a patient that actually had taken some medication for muscle relaxers, and she had an iatrogenic effect to it. It caused dystonic activation of her muscles in her neck and her trunk, and I ended up treating her for quite some time and got him somewhat stable, but eventually it just really went downhill from there. So that was my first patient, and then my second patient was this really challenging ADHD oppositional defiant. So, I mean, I just hit the ground running, in early in my practice.
You jumped into the deep end, didn't you?
Yeah, I jumped in the
or,
deep
or
end
got
and
thrown into the deep end, maybe.
I had no idea what I was doing. I had this education that I knew I felt pretty confident in. I had begun to learn what was the early part of Dr. Malillo's work. At the time, it was called unlimited potential. And so I was using these hemispheric principles that he had taught me, and I was applying them on adults and children. And I did that. I did that early in my first couple of years. And while I was doing that, I was also because of I think of my dad, passing from cancer, I always had this interest in immunology and understanding the immune system. And so I was just dabbling in it at the time and really beginning to, and Dr. Malone was dabbling in it as well. And then I would say the next person that came along that really impacted my career clinically was Datis Karazian. I mean, when I got to meet him and really begin to understand this thing that was immunology, and I met Aristo Vajani. Again, this is probably maybe 7 or 8 years later, so probably, like, around 2007, 2008, couple years into practice. That's when I was like, "Alright, here's my other love affair, okay, neurology and immunology," and then I realized there's this whole field called neuroimmunology that's emerging. I was like, "Man, I wanna make sure that I'm a part of that." So that's what's been the crusade now is integrating that at the highest possible level.
And, I have it's amazing how you have these kind of idea of how you're gonna practice and go into practice and, how life, basically can deride that real quick and put you in another direction. I mean, that's exactly, what happened to me. I was being pretty successful with, just using functional medicine. I had treated some kids on the spectrum and, I was doing the gut work and changing the biome and working on that stuff, and we had success. But, there was something that was in the back of my head, like, I felt like I was always treating the gut. Like, I would treat the gut on these kids, they would get better for a time, and then there would always be this, like, regression where we felt like I was kinda doing the same process over and over and over again, always trying to snuff out this inflammation. And when my son had his regression and was diagnosed, and, at this point, I'm probably, I would say 5 years into practice, and then I'm like, "I'm missing something," because when I treat adults, oftentimes they're neurotypical, I can treat their gut and we move on to other things, we stabilize it. always had the hardest time stabilizing these kids' guts. And even when I was working with my son, I was like, I know I'm missing something. And so that's when someone had given me the book Disconnected Kids, and man, that made a whole lot of sense when I started thinking about, hey, this isn't just the body doesn't function without the control of the nervous system. And so, really getting a firm understanding, not only what is actually happening in his brain, but how that impacted all of this other downstream physiological processes was a real eye opener to me. And even as I learned Dr. Melillo's works and started making huge progress with our son, um, I started noticing all my other patients that they have this imbalanced autonomic responses and high fight and flight and all these things that I'm starting to realize this is impacting how their body's operating from a very basic sense. And so, I think I think that's really, I think what you're doing is really on to the future of medicine in general, of how all of this stuff works together, especially as we have, more stress in our environment. We have increased mental health in general. So, um, I'm really excited about where this is all going. But I think there's a lot of confusion on what what it means to even do functional medicine. You don't even really. I think when you hear about alternative treatments to autism, if we just pick that, it's all about either biomedical, or you hear all these different terms that are out there. Can you help us, like, kinda unpack those different, like, I guess I would say, buckets of different philosophies, and kinda, give some context to them?
Yeah, I think it is very tribal, okay? And I think part of it comes from the fact that functional medicine is such an encompassing, I guess, umbrella because you have DCs that come from a certain background, you have naturopaths that come from a certain background, you have medical doctors that are coming from their classical medical training and then now deciding they're going to get into an integrative way. So I think it is very confusing for the public. Um, I feel what we're doing is probably more advanced than everybody else because I do believe that the naturopathic community and the standard integrative medical doctor still, I think in some ways, Tatis Karazin calls it green medicine, okay, where they're they're applying their medical model to, okay, let's diagnose, okay, or look at this collection of symptoms and rather than do, let's say, pharmaceuticals as the point of entry, we're going to do supplementation. Okay, we may address some lifestyle management, but they're not looking at it the way we're looking at it. Okay, and I think that that's the difference, or at least the people that have been trained by Dr. Melillo and I in terms of developmental neurology, and say, listen, you have to look at the way the human brain has developed over the course of that child's early development or into adolescence, into young adulthood, and then beyond, okay? And understand, as you said, that the brain is the master system and is controlling all downstream mechanisms. And so if there's any alteration in the development sequence of the human brain, what we're looking downstream in terms of cardiac function or endocrine function, immunological function is all related to the brain. And I think that's the missing piece that doesn't happen in the traditional functional medicine world. And I believe I can say that with authority because of the fact because I've been practicing for 20 years and the majority of my patient population that are coming from the functional medicine world are what I call dysfunctional failures, okay, where they have gone to a multitude of practitioners. They've run thousands and thousands of tests on them. And I'll tell you this, first and foremost, they never had a physical assessment, okay? A physical bedside examination, all right? Either by their primary care provider or by their functional medicine provider. And then taking it one step farther is doing the bedside assessment with a developmental influence of it, okay? Looking at how the brain has developed and looking at in an adult. Okay, does an adult that has an anxiety disorder, do they have retained primitive reflexes? Okay, do they have problems in subcortical areas of the brain like their brainstem or their cerebellum? that is not allowing for the optimal function of their higher centers of their brain, like the human frontal lobe. Okay, again, I deal with these type of patients on a regular basis where they've gone and they've done an organic acid test, they've done 5 stool tests, they've had, functional blood chemistries run on them. Um, and it makes sense. And I can understand why you would do that. But that's the tunnel that you're living in as a practitioner, and you haven't stepped back and you haven't looked at the development of the human brain as it relates to that person.
Yeah, I think that's a absolutely perfect way to put it, and, I even try to really simplify that with my patients and saying, "Look, I mean, if your body is wired to be, very simply in fight and flight all the time, then that's gonna activate your immune system all the time, right? I mean, we're gonna have a real trouble trying to regulate your immune system with whether it's medications or nutraceuticals or however you wanna do it on a functional medicine side, if you're not regulating the master control switch, that's, kind of generating that inflammatory response in of itself. I mean, I remember, one teenager I treated for stomach pain, and he had horrible allergies. I mean, just IgE allergies to all kind. I mean, they had to stop the skin prick test in the middle of the test because the kid was in so much pain from the inflammatory response. And a long story short, we ended up treating. We really did more of a neurological based treatment because heart rate variability, all of these different tests that we did and exam that we did showed this imbalance in his neurology. And, the goal of treatment actually wasn't really to deal with his allergies, necessarily, but as we treated him from that perspective, all of a sudden the parents came in and said, "Oh, he's tolerating his allergy shots all of a sudden." And that was a really powerful, moment for me to realize how significant this connection is.
Yeah. So when you can look at it from that perspective of how does the neurology and as you were saying, really this relationship of autonomic control and the balance between the sympathetics and the parasympathetics. And, for most people today in the world that we are in, people are more sympathetic dominant. So they're going to create a tremendous amount of central nervous system inflammation, which is going to really come from a lot of body inflammation. Okay. So now they're going to have this increased CNS inflammation that's going to happen in their brain. They're going to have these inflammatory cascades that happen in their brain that's going to reduce, functional connectivity. So you really have to do both. You have to change the central state of the brain and the nervous system, and then begin to change the adaptiveness of the immune system. So, what I mean by that is that you get these patients that have been in these chronic sympathetic or chronic systemic inflammatory mechanisms. And what it's done is it's altered the way their innate immune system is working and their adaptive immune system is working. So you do have to address that separately from the other because just like in the brain, we can get plasticity. Now we can get and then I think in our world, we talk about healthy plasticity, good plasticity, but there's also negative plasticity that can happen, okay, where we can get wind up in pathways, for example, or chronic pain patients, okay, that have a lot of efficiency in their pain systems, okay, and so they get a lot of wind up in there or you get these patients that have all these limbic disorders, okay? So they have all these different, whether it's depression or anxiety or bipolar, okay, or eating disorders, or again, emotional dysregulation. Um, they can get wind up in those pathways, all right? So, in a lot of ways, what you have to do is you have to activate certain networks of the brain to have an inhibitory aspect, but then you also have to try to downregulate the inhibitory or the excitatory pathways. And so the same thing happens in the immune system. And I think that that's where we're going now with the neuroimmunology. Okay, is that in in patients you do have to unwind their immunology. Okay, because just doing the nervous system stuff is not necessarily going to be enough. It may reduce certain levels of ongoing inflammatory aspects, but you still have to then say, "Okay, hey, I need to continue to unwind this, then we also know people can have individual genetic gain of function in their immune system where certain people can be more efficient at making certain cytokines. So they may make better at making pro-inflammatory cytokines that then again alter the way their adaptive or their innate immune system is going to work. So I think that's where the combination of both is really going to be the next generation of what we're doing.
Yeah, absolutely, and I agree with you a lot on the epigenetics. That's something I've been doing more and more here lately, and it's been really helpful just to see where those weaknesses are. Where are those pressure points in everybody's, system that can help? And even to your point, I mean, even on the simplistic side of things, if you have anemias or if you have low thyroid function or if you just have a B vitamin deficiency, I mean, that's gonna affect your ability to create neuroplasticity, right? We need those, essentially raw materials for even that to work. I always talk about neuroplasticity takes movement, it takes sensory input, but it also takes metabolic demand. You got to make that basic cellular ATP for all that to happen. So I continue to see this as a two-way street that you have to consider both. And I agree, it's going to be the future. So
I mean, one simple thing I would say there is one of the thing that I've been doing for quite some time now is running essential fatty acid profiles on every patient. Okay. And it never um, doesn't never amaze me that patients come back and they have tremendous amount of deficiencies for their omega 3s. Okay. So, and especially in a child. Okay. So how do you expect to create neuroplasticity when they're one of their major building blocks, specifically for DHA, essential fatty acid, is decreased, okay, and they have an abundance in omega threes, okay, or let's say they have deficiencies in fat soluble vitamins, okay. Um, for example, I mean, we talk about vitamin D, but it's really not a vitamin; it's a hormone, right? So there's all these things that happen intracellularly, okay, with vitamin D. So vitamin D has functions that are going to have genomic effects, okay? For example, the ability to have anti-inflammatory or even anti-cancerous functions, what we call anti-proliferation mechanisms of vitamin E, happens on a genomic level where the vitamin D gets into is that we're not talking about the receptor on the outside of the cell. We're talking about actually the vitamin D receptors inside the cell. So vitamin D goes through the outside of the cell into the inside of the cell, gets in and creates all these genomic effects. Now, how many people are walking around with low vitamin D levels? Okay, whether it's a child or an adult. So, I mean, this is something that is really important that has to happen.
yeah, I mean, 100%. And the big thing that has happened recently is I have very mixed emotions. Like I'm very happy that we do have some direction from the administration and the government that hey, we're looking at other things that are inflammatory, and we get into the whole Tylenol debate. The looking at Leucorvin as far as a maybe a treatment. But as much as I'm happy that this is we're trying to communicate to the public that there is more to consider and more that should be done. I don't know how you feel about it, but I think the messaging has been absolutely terrible.
I
And
mean, Dr. Malone and I were talking about it recently, and you're right, it's completely terrible. First of all, Tylenol, it's just a known risk factor. We've known it for, 15 plus years, 20 years now. I mean, Dan Murphy's been talking about this at least for 20 years in his reviews and his seminars. And so we know it's another laundry list of a risk factor. If you haven't, for those in the audience, if they haven't read Dr. Melillo's book on autism, that he wrote about a decade ago. At the time, he lists, almost 30 some odd different potential risk factors. So it's just another risk factor. It's not the smoking gun. There's no smoking gun. I think that's the
exactly,
problem. Okay. Everybody
exactly.
wants to the Maha movement and I think there's some great benefits of the Maha movement, but the Maha movement has been hijacked by the vaccine people. They want to blame vaccines for everything. That's not the case. I mean, I see non-vaccinated children of chiropractors and natural healthcare providers as well, and they have different levels of autism. I mean, sure, there's a certain percentage of children that are definitely having some effects from the vaccines, okay? But the fact of the matter is it doesn't really explain the laterality strengths that we see in these children, okay? The vast majority of children that I've ever examined, and I've examined thousands of children, I know Dr. Melillo's examined thousands of children, the majority of them have very augmented strengths of their laterality, okay? And even in the children that are level 3 autism that are defined as nonverbal children, um, we're finding out have extraordinary left brain function, okay? So, if that's the case, how is that happening? And I think that the only way it happens is the strength of the epigenetic influences of the family lines, okay? And looking at both mom and dad and looking at maybe 2, 3 generations, maybe even 4 generations if they can remember what their great grandparents were like, in terms of their strengths. Because to me, I think that's probably the most indicative, for lack of a better word, biomarker that tells us how we may arrive here. And, as you begin to understand the laterality of the human brain and understand how the left brain and the right brain work, and especially when we think of it more of from an immunological perspective, we think that the left brain has more of a sympathetic component to it, and the right brain has more of a parasympathetic component. So, sympathetics being more of an inflammatory mechanism, parasympathetics being more of an anti-inflammatory mechanism. So, right off the bat, if there's a alteration in brain laterality within the first or second or third trimester, even before the child is born, okay, is it possible that if there's a shift more towards the maturation of the left brain developing early on in the womb and within the first several months of life, is the child's already their immune system already towards an inflammatory state, okay? So then, if you then decide, "Hey, we're gonna give a vaccine, and we're gonna give a vaccine with all these adjuvants that are there to promote an inflammatory state anyway, what are we gonna get? We're probably gonna get this greater inflammatory state, but it's really about the left hemisphere, okay, being more developed, and so I think that's the thing that we need to keep track of, and then as far as, like, leucovorin goes, listen, I've been doing this for 20 years, I know you've been practicing for quite a while. We always see generationally, probably every 4 or 5 years, some medical physician come out and say, "Hey, I've figured autism out. It's this particular one substrate, and if
Right.
we do this, we're gonna fix." I mean, I remember when I first got into this, there we were talking about different medications and they were it was crazy what everybody, and then, 4 or 5 years ago, the main thing was, "Hey, let's do all these fecal transplants on these kids, and
Right.
we're gonna treat autism," okay? So, yeah, is there potentially some benefit of this? There's potentially, but it's not this, "Hey, this is gonna treat all autism," okay? Alright? And the question is, and this is one of the things we have to look at is, like, why is there antibodies being made to the folate? Okay?
Absolutely.
Right? Probably because there's a dysregulation in the immune system, okay? And probably because there's a Th2 dominancy because that's the Th2 system is actually what makes antibodies, okay? Or the T follicular cell system is upregulated and we're getting hyperglycation and then we're getting more antibody activation, which again, by the way, is all under the control of the brain. Okay. So I just think there's a lot more unknowns than we do know. And for the audience, I will say to them that they need to read Dr. New research paper that he published, and it was all about this. It was like, I mean, it's a massive paper, and he went through him and his Dr. Leisman went through what we know about autism and what we don't necessarily know about autism, and really broke it down. And they talked about leucovorin and they talked about the folate antibodies and everything.
Yeah, that was a great paper. It really did a great job of kind of really putting some context to all of these things. And I don't think a lot of people realize too is, all all that drug is just a bioavailable version of a nutrient, which I mean, you can buy on over the counter tomorrow. That I mean, it's in higher doses, obviously, but even as you alluded to there, it's a subset of autism that are going to be more likely to benefit from that. So yeah, I know. I think it's somewhat human nature, but also especially in the way our allopathic system is set up, is that we want these singular causes, we want these singular treatments. That's how we deal with a lot of diseases in medicine in general, which is, I would argue part of our problem in general. But yeah, it's
No,
it's
what's
really
easier? What's easier, taking a medication or a supplement over the counter, um,
or
or
balancing the whole body.
or balancing, yeah, balancing the brain, eliminating primitive reflexes and everything. Yeah, I mean, working and doing eliminative primitive reflex integration training is not easy. Okay, but yeah, I mean, I'm in some of these Facebook groups, and I just read and hear some of the comments, and you will hear some of the comments and say, "Oh, my child's talking." No one really says like, "Well, they just say, "Oh, all of a sudden it made my child talk." I've worked with a lot of cases over the years, and I know you have too. Neurologically, it's not like a nonverbal child all of a sudden just instantaneously starts talking in sentences and comprehending, okay? So, I think that there is a message here that has to be where, okay, yeah, it's worth a try. You can try it. I mean, people have asked me about it. "What do you think?" I'm like, "Hey, try it. See if you see any difference," okay? But do not stop doing the
Everything else.
neurology
Right.
aspects or any other brain training that you're doing, because you believe that this alone is going to quote unquote cure your child.
Well, and that's the thing is, and I communicate this to people as well, that let's even say that this, and even when you go back to Tylenol, really it's the oxidative stress, is the theory behind that, right? That kind of shifted things to not develop normally. But even if you get a child 5, 6, 7 years old and you've gotten rid of all of their inflammation, they're behind 5, 6, 7 years in their development. So is that just gonna magically, wire and become balanced and normal? Even if you do identify some of these underlying mechanisms that may have created the scenario, at a certain point, it becomes irrelevant because you still have to find a way to create that, and I love that term, positive neuroplasticity, to create balance within the nervous system.
Because my question is, just because you take it, you know, one, do you even know if your child has retained primitive reflexes? Okay. And let's say you give them leucovorin and it's not going to magically all of a sudden establish plasticity in the brainstem. Okay, that's not what it's doing. I mean, it's like you said, it's probably having an influence on oxidative stress, which in itself can, have a tremendous impact on the immune system. Okay, and reactive oxygen species and everything, and push the immune system into a certain state. So you might be able to dampen that inflammatory CNS inflammation mechanism. Okay, and the reality of it is CNS inflammation is happening for a multitude of different reasons. So it may work for some people because that might be the mechanism that's maybe driving some of their CNS inflammation. But I can assure you in other cases that is not the case. That there's other mechanisms that are driving CNS inflammation. You can drive CNS inflammation from overactivated histamine responses, okay? And so these are things that I think that unfortunately in the state of the social media world that we're in, and anybody with an opinion can get on there and claim this and claim that. It just creates a tremendous amount of confusion for patients.
So, for clarity for our listeners here, we've talked at length here about how important the nervous system is. What do they need? What do parents need to know about? Especially even as they're trying to identify practitioners to work with and that kind of thing. Where do they need to start with helping that neurological balance?
Well, one, I think they start with the Disconnected Kids book, okay? I mean, it's
Hundred
on the
percent.
3rd edition book, okay? You don't get a 3rd edition by a major publisher. Dr. Malo is not self-publishing books, okay, first and foremost, right? He's gotten a book deal from Penguin years and years ago, and that book blew up, okay? And then from there, he was asked to write a second one, and then he's done a 3rd one, okay? So, first and foremost, start with the Disconnected Kids book. Then from there, you need to find a practitioner that's been trained directly by him and I. I mean, you being one and others that we've gone through, and the level of education that we're providing in those courses, okay? Which I think are, for someone who not only teaches post-grad classes, but participates in them, I don't think there is a program out there that is as challenging as the program that we put our practitioners through. So, I think that's where it starts. And then, obviously, we have our brain balance centers that were centers that Dr. Melillo had started and I had started years ago, um, that are a great option as well. But I think that, starting out with getting the Disconnected Kids book, wrapping your head around the idea of functional disconnection syndrome, okay, the fact that there is quote unquote this imbalance between the brain functionally, that the brain has not been damaged per se, okay, and even if in these kids that have had various genetic disorders or been diagnosed with genetic disorders or have had traumatic brain injuries, a lot of times you probably can pick up a laterality difference there, but even if it happened early on in development, the reality of is that it probably impacted the right hemisphere. So we would probably start with right brain based treatments anyway. So I think that's the big thing is starting with the book itself, and then finding a certified practitioner in the Melillo method is very important.
I 100% agree with you. I mean, every time I have a patient who, asks me, "Hey, what do you do with kids with autism?" That's the first thing I do is I go and grab a copy of that book. We keep a ton of copies in the office. I just hand it to them. I go, "You need to read this," and start from there. Because and I think that's important too because he does such a good job of, and that was what resonated with me as a parent, not just as a provider, was, man, this is actually making sense onto what I'm seeing when I'm seeing, because he was by far the first person to explain to me what was happening, what was going on in my son's brain. And I find that weirdly therapeutic too. That was therapeutic for me as a parent to understand that, and also know that this is not set in stone. This is changeable. That you can make such huge improvements with it. So I couldn't agree more with that.
And then the other thing about it too is that and that Dr. Melillo has been the leader in research. Okay, functional neurology, as we know it today, would not be where it is if it wasn't for the creation of brain balance centers almost 20 years ago by Dr. Malo. Okay. He was the first person that ever came and actually had a system. Okay. For a better part of 15 plus years or earlier than that, I mean, I think I'm in like the second, third generation of functional neurology group. There was no system. You would go to seminars, you would get trained, and you would, okay, go and do this. And it was very individualistic. Okay. And then when I met Dr. Melillo in 2004, I felt so much relief because I started my neurodiplomate program in 2001, and when I went through it, after I went through it and did the 300 hours, I was excited about it, but I really didn't have a system. And then when I met him and I learned this system, okay, and then that system is eventually what became the brain balance methodology in 2007. And now, 3 years ago, Dr. Melillo said, "Hey, we're going to develop this Melillo method process." Okay. Um, and so everybody in the functional neurology world has actually benefited from all the years of brain balance where we were doing this system and then we were actually publishing outcome studies about the protocols and the systems. Simultaneously, Dr. Malone was publishing individual papers um, about the brain balance model. We actually had Harvard Medical, McLean Hospital do an independent study, a small pilot study. We would have loved for it to be a larger study, but again, as a private organization at the time, we were limited on our fund that we raised, but we got a pilot study done. Okay, now, Dr. Malo just completed his PhD in cognitive neuroscience, and he just actually published a new paper yesterday on the remediation of primitive reflexes and showing how it changed cognition. Um, so, no one, and I mean no one in the functional neurology world has published more outcomes and theoretical papers, outcome studies, case reports utilizing his methodology. So I don't think functional neurology would have a leg to stand on if it wasn't for what Dr. Melillo has done at this point. And all the people that are copying his work um, should let the world know, hey, we're basically bastardizing his protocols because, you know, we don't have any studies, we haven't done any work, we haven't contributed to the literature. Okay, so yeah, I think that's a big point too, is that for those who really want to have these changes in their child, they have to find someone who's been certified and does the Melillo method protocols the way they were intended to be done.
All right, we're going to move into a little rapid fire Q&A. I'm just going to ask you a few questions. Just let me know what you think about these. But what would you say your most underrated lab test is? If you had to run any lab test, what would it be?
That's a great question. I mean, it depends probably on the case in front of me, okay? But to your point, I thought that the anemia would be, something you always want to look for. So I would say simply, like a CBC with white blood cell differential is a great thing, okay? Because you can really look at, what's happening from like you said, looking for anemia. I would throw in, the iron portion of it to look at iron. I definitely think that essential fatty acids would be a great starting point. Now looking at what we call the vitamin D system, okay, not just looking at 25 hydroxy vitamin D, but 125 and parathyroid is a very specific integration that comes there. Um, if you have the ability to throw in total glutathione in the serum, okay. For me, it's always about doing serum testing first, okay, and then we can move on to some of the subspecialty labs there. But it always grates at me when I see people running off and running oats test or running stool test or some other functional medicine kit or hair analysis or whatever that has no basis of reliability. Again, before they run a serum profile and really do a good thorough there for that.
If for perhaps a pediatrician, your typical pediatrician who may be watching this, what would you want them to take away from this?
Well, one, I'd like for them to take away the fact that, people that have gone through the Malone method training and gone through our 150-hour course are really well trained in developmental neurology, okay? And not only that, and then also been trained in, um, I think, functional blood chemistry and also been able to now understand a greater degree of immunology labs. So I think that that's important for them. I think, but more than anything, is for them to know that beyond just the standard OT or speech language pathologist or physical therapist, that there is this subgroup of practitioners that have been trained in developmental neurology at the highest level.
And finally, how do you see this progressing in the next 5 years? How do you see the treatment of autism and neurodevelopment in general going?
I mean, I think it's a wonderful question. I do believe I know where Dr. Malo and I's brainstorming sessions are going. I can tell you that I think for us, we're working on trying to legitimize some of the applications that we're currently using. For example, obviously over the last several years, the craze has been low level lasers, right? There is a lot of people, companies that are developing these low level lasers. Um, but we need to obviously look at the specificity of how we're using them in terms of um, frequencies that we're using, okay? And I think that's something that I know Dr. Melillo is looking at very closely and understanding how we use low-level lasers specifically on children that are 3 versus 5 versus 7 versus 10 into young adulthood. So that's one thing. Um, Bioelectric medicine, okay? The ability to utilize transcranial direct current stimulation or transcranial alternating current um, using various vagal stimulators, okay, that are out there, and even some other devices. But again, looking at them in a very specific way, looking at them being able to influence, let's say, very specific areas of brain. You've heard Dr. Mull talk about these things called Brodmann areas and being able to specify very treat into a very specific Brodmann area, but we also know the Brodmann area is related to a network, a neural network. So where we're going right now is trying to use the current diagnostic equipment like QEEG, um, and really developing more sophisticated um, diagnostics with that. Okay, we're not satisfied with the current um, way that QEEGs are being done. We do believe there's some limitations there in the different systems. So I think that's where we're going at. We do know we would like to be able to maybe build some transcranial units that will give us the capability to not just isolate out a specific Brodmann area, but maybe be able to do multiple Brodmann areas
That'd be awesome.
together, as well as also being able to look at, can we use transcranial stimulations in specific frequencies, okay, that we want to work. So I think the answer to this is a systems model, okay, a systems model, because that's where we're going in the immunology world, is looking at a systems model of immunology. Dr. Ari Vijani has been talking about this for years. He's been, lecturing at this with Jeff Bland for at least 5 or 6 years. Is that we're moving from a partition model to more of a systematic model, and I think that's where we're going with this. And then we're going to continue to validate what we do, so that way we can continue to say that we are indeed the leaders in the world on this, and that no one else has this type of research and the outcomes that we have, and that you need to be doing it this way. And if you're not doing it this way, you're doing an injustice for that child.
That's great information. And Dr. Scire, I really appreciate you taking the time to dive into this with me. I mean, I think everyone's going to take away a wealth of information from this. If any of the listeners want to know more about your practice or how to work with you, what's the best way to get in touch with you?
Actually, the best way is just to follow me on Instagram, Dr. Peter Scire. I have a pretty decent Instagram following. They can find me on Facebook as well. Dr. Melillo and I have the Melillo Method podcast that we do. We haven't been able to do as many this year because I haven't been in New York as much, but we do have a couple more episodes coming out, and then next year we'll be doing that as well. So yeah, I think that, and then there'll be a big announcement here soon that we're probably going to be teaching again next year, maybe one or two specialty courses. But I know that Dr. Mull and I are organizing for a new class next year, hopefully the latter part of the spring.
Well, I'll be there for that for sure. So,
Absolutely.
all right. Well, I thank you so much for joining. This is that's the end of our episode here on the NeuroTrition Podcast. Thank you everyone for tuning in. Don't forget to like and subscribe and follow us on TikTok, YouTube, Instagram, and Facebook at NeuroTrition Podcast. And we'll see you on the next episode.